Are you dealing with a herniated disc? If you are not alone. There are so many people that walk into my office with herniated discs, all hoping to avoid surgery, and the good news is you can do exactly that. Today, I'm going to share exactly how I help my patients and people just like you get back to living pain-free without needles, without medicine, and without the operating table. Hi, I'm Dr. Charlie Oliver. I'm a chiropractor and physical therapist practicing right here in San Antonio, Texas. One of the most common issues I see day in and day out is herniated discs in the back and in the neck. These problems always cause pain, and if they're bad enough, they can even put pressure on the nerves going out to the arms, going out to the legs, causing numbness, weakness, and even shooting pain down the arm or leg. Now, this is terrifying to most people because they assume this means they're going to need surgery, and then they're coming to me to seek my help so they can prevent that. The good news is that's exactly what we do here. We help you manage this condition naturally. Trust me, you've got more control over this than you think. So let's start with the basics, what you shouldn't do. So if you've been told you have a herniated disc, there are 3 big habits that can make things worse. Number 1, prolonged sitting. So sitting for hours, especially with poor posture, puts a lot of pressure on your spine. Imagine squeezing a jelly donut. Too much pressure and it's gonna leak. That means your disc is under stress and it's gonna get pushed backwards. Number 2, excessive bending. So constantly bending, like picking things up off the ground, whether they're heavy or even if they're light. Over time, that repetitive motion makes a disc bulge or a disc herniation worse. The key there is bending over or even lifting objects up. You've probably always been told to lift with your legs, and that's great advice. You want to use your legs more than your back. But to be frank with you, what I think is more important than using your legs is making sure you're keeping that arch in your low back. You've got to tighten those muscles up in your low back and accentuate the curve. Now let's flip the script. So here are the 3 big things you can do right now to start stabilizing and strengthening your spine. Number 1 is core strengthening. Your core is like the foundation of a house. If it's weak, the whole structure is unstable. So exercises like planks, bird dogs, and bridges, they all help strengthen your core and take pressure off your spine. Number 2, be aware of your posture. So think about how you're sitting, how you're standing, even how you're sleeping. You got to keep your spine in neutral when you're standing, and then when you're sitting or when you're bending over or lifting something up, as I mentioned before, you got to keep that arch in your low back. So you want to keep those back muscles engaged to accentuate that curve to protect the disc. In other words, when you go down, whether you're sitting or even tying your shoes, turn those muscles on, keep that arch in your back present. And then the 3rd big thing to do is spinal mobility work. So gentle stretches like cat-cow, pelvic tilts, all of those things help keep your spine mobile and reduce stiffness. So an exercise as simple as even sucking your belly button backwards actually has been shown to tense up important core muscles that are going to stabilize the individual bones of the spine. Along with this, pair these with low impact activities like walking or swimming to improve circulation and support healing. If you're the type of person who loves working out like I do, I'd stick with these exercises over running for distance on a hard surface or being hunched over a bike for a long period of time. You want to minimize the shock and compression while also keeping good posture. The elliptical and treadmill both allow for this. And if you're going to use a bike, especially a stationary bike, just make sure you're sitting up really tall. Just remember, avoiding surgery doesn't mean doing nothing. It means taking proactive steps to strengthen your body and protect your spine. If you're dealing with a herniated disc and don't know where to start, come see me or search for a corrective care chiropractor in your area. It's critical to have x-rays taken to study your alignment and compare it with a healthy normal. If you're out of alignment or don't have the appropriate amount of curve in the spine, you've got to get that fixed as soon as possible. As always, thanks for watching. If you found this helpful, don't forget to like the video and subscribe for more tips on staying pain-free. Drop your questions in the comments below and I'll answer them in a future video. Until next time, take care of your spine. It's the only one you've got.